And today we've got the afternoon concurrent session on aged care in hospitals. And the first up to the stage, as they say, is Lillian Miles with Advanced Falls Assessment, Development of a Concern about Falling Scale for Long-Term Care. And Lillian is from Neura. Thank you very much.
So hi everyone, thanks for your time today. I'm Lillian, I'm an exercise physiologist and research assistant at the Falls Balance and Injury Research Centre at Neura. So today I'll be presenting our preliminary work on developing a concern about falling scale for residents living in long-term care settings. Dr. May Lim touched on it during the middle session of the day. So this project came together thanks to a fantastic team of researchers and experts, and yes, a special shout out to Dr. May Lim for driving this project. So concern about falling is common in long-term care, with about 85% of older people experiencing some level of concern, and 2 in 3 who avoid physical and social activities due to fear of falling. Concern about falling in long-term care includes fear, reduced confidence, and reliance on staff. It also presents differently than in community dwelling older adults and can be expressed as reluctance to mobilise without assistance. Concern about falling can even occur in people who rarely mobilise independently. So why developing a concern about falling scale for long-term care is important? It's because few studies have assessed concerns about falling among long-term care residents. Existing tools rely on verbal descriptions of activities, such as the FESI, and activities are often irrelevant to long-term care residents, such as cooking, housework, shopping. So the development of a concern about falling scale for long-term care was adapted from the I Confess for community, which includes both visual and verbal descriptors for each activity. So our primary aim was to co-design a concern about falling scale for long-term care residents with long-term care residents to understand activities that reflect their daily lives and concerns related to falls. Our secondary aim was to identify gaps in current concern about falling management practices in long-term care settings. So in phase 1, we undertook observations of residents' daily routines and interactions at 2 long-term care homes in regional New South Wales. We then conducted semi-structured interviews with residents and long-term care staff to identify daily activities related to concerns about falling and current management practices. So then from the interview findings and expert consultations, came the adaptation and development of new scale items. We pilot tested the new scale items with residents who participated in phase 1. And then from residents' feedback and expert consensus, further refinement was made to reflect the daily activities of these long-term care residents. So here's a bit of a snapshot of our participant cohort. So it included 15 residents and 10 staff. The average age of residents that we interviewed was 85 years, and one person actually had a vascular dementia diagnosis. However, they were able to meet all study requirements. So from the interviews, 4 main themes emerged: activities or factors that influence concern about falling. Having a concern about falling tool in the long-term care setting is helpful. Individual factors that trigger concern about falling, and that more interventions are needed to address concern about falling in long-term care. So theme 1 really relates to the first aim by identifying and describing the common activities that trigger concern about falling among residents. So daily activities such as personal cares, mobilising around the facility, getting on and off transport were all commonly identified as triggers for concern about falling. Residents also talked about strategies they use to moderate concern in everyday activities, such as when standing unaided at the bathroom sink, they're conscious not to move without holding on to support. It was also highlighted that during the interviews that residents rely on walking aids and staff support to get them through their daily activities and general living. So theme 2, having a tool like this is helpful. Having a concern about falling tool enables staff to better understand residents' concerns and provide more targeted care. So there were instances where staff talked about the difficulty of identifying concerns about falling, where residents either internalised or minimised their concern. So a structured tool would provide a more objective measure of concern about falling and help staff manage residents' concerns better. So theme 3, individual factors that increase concern about falling in residents include having a previous fall, advanced age or illness, and individual beliefs about fall prevention. So residents reported having had a previous fall or seeing other residents fall increased their own concern about falling. Staff agreed that a single fall event can significantly affect a person's confidence and mobility. Then theme 4 describes current gaps in available interventions for managing concern about falling in long-term care, highlighting the need for more structured activities and higher participation rates in exercise programs, better education about falls prevention, and evidence-based interventions tailored to the long-term care setting. So staff also raised the need for education aimed at reducing residents' reluctance to seek assistance and addressing concerns of inconvenience. So one of the quotes was, a lot of them don't like to admit that they need help. A lot of them don't like to use their call bell because they don't think they need help or they don't want to ask for it. They just don't want to be an inconvenience. So this is where education would help with addressing that. So then in phase 2, a draft scale of 17 items was developed from the phase 1 interviews and expert consultation. The draft scale covered a range of activities relevant to long-term care, including activities of daily living, navigating inside, outside the facility, and mobility when getting on and off organised transport. And also tasks that challenge balance while using walking aids, such as reaching for something or leaning. And the scale was then pilot tested with 9 residents. So all residents reported that the questionnaire instructions were clear, the questions were easy to understand, and the activities reflected their daily lives. Following the pilot testing and expert consultation, an additional 3 items were added, and these were getting in and out of a car with assistance, either by a family or a staff member, participating in a group class exercise seated, and the last one, walking down a slope. So this resulted in the final 20-item I Confess LTC scale. So 7 of these items were adapted from the community-based I Confess, and these activities reflect activities and environmental factors that influence concern about falling. So we've got, activities from mobilising in their own room, such as getting out of bed, particularly getting to the bathroom, even getting to the bathroom at night when there's low light, navigating crowded indoor common areas, so often in the walkways there might be trolleys, there might be walkers left abandoned, there's always some sort of navigational issue. As well as managing uneven surfaces and unpredictable outdoor environments. So, such as going out for a walk and having to navigate the curb, stepping on and off a curb or gutter. So, and as well as performing tasks that challenge balance while using a walking aid. So things as simple as reaching for the door handle to get out of your room when you've got a walker between you and the door, or simply picking up a tissue that's been dropped on the ground. So here we have examples of new illustrations for the long-term care scale. So what we wanted to ensure is that the illustrations were clear by including only the essential components of the activity and for them to be relatable to our target population. This is the adapted scenario of reaching for something on the ground, which in this case includes a walking aid for support. So this study had several strengths. It's the first co-designed concern about falling assessment tool for older adults living in long-term care. It's the only tool to incorporate perspectives from both residents and care staff to develop a scale suitable for long-term care settings. And the use of contextual images and visual icons increases this tool's inclusiveness, so we can capture concern about falling in people with varying levels of cognitive ability, which is critical given the high prevalence of cognitive impairment in long-term care settings. So while pilot data suggests that the iConfess LTC captures a wide range of concern about falling levels, further psychometric testing is required. So we're looking at validating this in a larger group of people, so we want to validate this in 300 residents as our next step. So the iConfess LTC could be a practical and scalable tool to support staff in identifying residents with concern about falling. So this means that concerns can be picked up earlier and addressed with tailored support. It could also be used to track whether falls prevention or psychological interventions are working in long-term care settings. So making concern about falling a routine part of falls risk assessments could help staff respond more effectively. So by identifying and addressing these concerns, staff can support residents to stay more active, reduce unnecessary activity restriction, and improve overall wellbeing and quality of life. Thank you. So yes, if there is anyone working in long-term care and is interested in hearing more about the scale or would potentially like to participate in validating the tool, please come and speak to me.
Fabulous. Thanks, Lillian.
Thank you.
Does anyone have a question? We have a bit of time for questions, if there's one or two. No?
But yes, I would, anyone who was working in aged care, either come and see either myself or Dr. Maddie.
I have a quick question. Were the staff open to being part of the research, and how was that sort of...
Yeah, they were actually. Yes.
Use the microphone. So
they shared, yes, a lot of insights, and I guess expressed a lot of the concerns that the residents perhaps didn't verbalise as much, and I guess we got a lot of insight from the staff's observations and what their responsibilities and tasks are on a day-to-day basis. And it kind of made us think, well, how can we help address some of those so the staff's time can be better spent doing other things, and having a bit more of a structured tool and giving the staff more of an idea of levels of concern about falling and helping those who are more concerned. And
Great. Thanks very much.
No problem. Thank you.